Good afternoon. My name is Chance Bolter, and today I will be going over our Module 6 final project for analysis of sports skills. Within this video, you will see two segments. The first segment being a video abstract, and the second segment being an in-person, hands-on description of my final project. I want to continue by giving the viewer a viewer discretion as there were noises outside that were out of my control. This may make the audio difficult to hear, but I have enabled subtitles so where you can at least see the words within the video. I want to begin this video by giving a quick video abstract or a quick brief overview of the skill that I have selected within this final project. The skill that I have selected for this final project is the skill of throwing a baseball. This skill is important to me as I have aspirations of becoming a future baseball coach, whether that be at the middle school, high school, or collegiate level. In order for any individual to participate within the sport of baseball, they must be able to throw a baseball. The sport cannot be played and the rules cannot be followed if an individual cannot throw a baseball. All positions within the sport of baseball require the usage of throwing a ball, whether that be the pitcher, the catcher, an infielder, or an outfielder. All positions require the skill of throwing a baseball. For this video specifically, I will be targeting and talking about the pitcher's position. Within the next video segment, you will hear me talk about two main issues when it comes to the skill of throwing a baseball. These issues include the leaking or energy shift of momentum forward and the lack of stacking or staying on the backside or the push-off leg of the thrower. When an individual fails to have proper lower body mechanics, this will affect the overall throw as a whole. This could include the accuracy of the throw, the mile per hour of the throw, or the overall just execution of the throw in general. It is important that any individual trying to participate or perform the skill of throwing a baseball has proper lower body mechanics so that the upper body mechanics may follow pursuit. If an individual fails to have proper lower body mechanics when trying to perform the skill of throwing a baseball, this could lead to injury of the arm. This could lead to a less accurate throw or a throw that has less mile per hour. As a future coach, I have full confidence in my ability to diagnose an individual's skill of throwing a baseball because of my preparedness. A few examples of how I would prepare myself as a coach to feel confident in diagnosing this plan is by doing my own investigative research about what is proper and what is not, networking with other coaches, deliberating with them and gathering their opinion on what a successful throw should look like, visiting coaching conferences to stay up to date with the most recent knowledge of how to demonstrate or prescribe the most effective throw, and by using my own experience of playing 6 years at the collegiate level. As a coach, I would first diagnose my athlete's skill of throwing a baseball by allowing them to perform a set of 15 to 20 throws. This will allow me as a coach to be able to break down the mechanics and visually see flaws or negative areas that I may wish to work on with the athlete. Within the following segment, you will see me be hands-on with an athlete going over the skill of throwing a baseball. Within this video, I will talk about multiple assistive techniques and the type of intervention plan I would use to further develop and execute a better skill of throwing the baseball. Some assistive techniques would be doing intervention plans within the weight room and using mechanical guidance to help the athlete develop better mechanics to throw a better ball.
As previously mentioned, today we're going to be talking about the skill of throwing a baseball. For this instant, we're going to be talking about the importance of that skill from a pitcher's position. What's cool about the pitcher's position is that it is the only position on the field that touches the ball at every point of the game. Whether that be the home team or the away team, the pitcher has the ball in his hand every play. This requires the skill of throwing the baseball for every play. Two of the most common mistakes for pitching is that the athlete leaks their momentum and energy forward, and that the athlete fails to keep their power and energy stacked on their backside. This may cause a less of an accurate throw, a less velocity throw, and overall a more poor utilization of the skill of throwing a ball. As I mentioned before, after doing my research as a coach, gathering my knowledge from coaching staffs around the country, visiting coaching conferences, and after my own experiences of playing and utilizing this skill, as a coach, I have full confidence in my knowledge to be able to prescribe and diagnose this skill. As I mentioned before, today with my demonstrator, Michael, I will be diagnosing his throws by allowing him to throw 15 pitches. This allows me as a coach to break down his mechanics and his skill of throwing the ball with my own eyes. So here's what my demonstrator's mechanics look like today. As I mentioned before, the two main flaws with that is that the individual leaks his energy forward and fails to keep his energy and power stacked on his backside. To utilize this, we can do two types of assistive techniques. The first one may be assistive techniques in the weight room. For the weight room, I would prescribe this individual two specific exercises to help him keep his energy stacked on his backside and be able to work in a unilateral plane. The first movement that I would prescribe this individual in the weight room is a Cossack squat, performed as so. This forces the athlete to really sink into that backside and feel him load and keep his power in that unilateral segment. The next exercise in the weight room that I would prescribe is a single leg pistol squat, performed as so. This forces the athlete to be able to feel that unilateral load in his back leg. Just like pitching, that's what we need to focus on and prioritize instead of leaking and allowing our energy to fall forward. The second assistive technique we would use is a mechanical guidance. For this assistive technique, we will be using an elastic band, or you can use a belt of some sort or any type of kind of a band or whatnot to force the athlete to kind of keep his body stacked on his backside and really load into that unilateral plane. So as a coach, using this mechanical guidance, I would allow the pitcher to perform his mechanics while I pull back. This will force him to stay stacked on his backside and keep his energy on his backside so we can have proper lower half mechanics so we can perform a more successful and more accurate and a higher velocity throw. And it's gonna look like this. So he's gonna lift his leg, perform his mechanics. I will be pulling him back to stay on his backside, and he's gonna really sink into that back unilateral lower extremity and really feel all that power and that energy loaded into his backside. Performing this mechanical guidance allows the athlete to truly feel what it's like to stay backed and to not leak his energy and all of his power moving forward. As I mentioned before, when the athlete keeps his energy back and uses his lower half properly, this allows the upper body to follow pursuit. Combining the two will allow for a more successful throw, a throw that is more accurate and has higher velocity. After diagnosing the athlete's mechanical flaws in the skill of throwing a baseball, my athlete, after the assistive techniques prescribed, went from this to this. better syncing and better proper use of using the lower extremity within the skill of throwing a baseball. There are a few ways where I could see if this skill or if these assistive tools help the athlete with his skill performance. A few ways include I can look if there are any mile per hour velocity gains. I can compare his accuracy via strike to ball ratio, and I can talk to the athlete with regarding how he feels. How does the body feel? Is it injury? Is there any injury? Is it painful? Or does he feel overall healthy and feel smooth, proper, and able to perform the skill at the highest level of his capability?